Hello everyone, this is Dr. Ananya. Welcome to my channel. In today's video, I'll be talking about double marker test. Before beginning the video, I would like you to subscribe to my channel if you haven't, so that I can share all the valuable and useful information with you. Pregnancy is a wonderful time in a woman's life, but sometimes it gets scary with the number of tests and procedures. During pregnancy, a large number of tests are required to make sure that the mother and the baby both are healthy and safe. One of the tests is double marker test. It is also known as dual marker test. So now let us know what is double marker test. As the name suggests, dual or double. It measures two values. It is done to identify any chromosomal irregularities or abnormalities in fetus. Chromosomal abnormalities are rare, but they cause development abnormalities. It is also used to detect conditions like Edwards syndrome, Down syndrome, and trisomy 18. So now let us see when is this test conducted. This test is usually conducted in the first trimester between week 9 to week 14. Most of the times, doctors recommend this test to do in the 10th or 11th week. Now let us see how is this test done. For this test, a small sample of blood is required. The blood is usually withdrawn from the vein of your arm, which is then sent to the laboratory. The results usually come in a few days. So, are there any risks to the test? There are almost no risks to the test as it only requires a small amount of blood. But make sure during the test the needle is well sterilized and the area is properly cleaned. Now let us see who can take this test. Basically, this test is meant for all the pregnant women. But if you're pregnant and if you have certain factors, then you may take this test. These risk factors include being age of 35 or more than that, having a family history of congenital diseases, and having a history of diabetes in the family. Now let us see what do we test in double marker test. Double marker test is usually done for checking beta-HCG and PAPPA, that is, pregnancy-associated plasma protein A. The levels of beta-HCG and PAPPA will help to detect any neurological or chromosomal problems in the fetus. Sometimes an ultrasound is also done as a part of this test before taking the blood test. This test requires no preparations, but if you are under any sort of medications, then your doctor might ask you to stop taking these medicines 24 hours before the test. Few years back, this test was very expensive, so not everybody could afford it, so it was only recommended for special cases. But due to medical technology advancement, this test is available everywhere and is affordable. So now it is recommended for every pregnant woman to take this test. Now let's talk about the results. For double marker test, the results are either positive or negative. The results of double marker test do not confirm any diagnosis. It tells us the chances of baby having any sort of disorder. The result is pretended in form of ratios. Now let us see what does a positive result mean. If the ratio is anything between 1:10 to 1:250, then it is considered positive. It also tells that there are high chances of baby having defects. A ratio of 1:1000, that is 1:1000, is considered negative, and it indicates that the possibilities of having any neurological or chromosomal abnormalities is very low. Most of the times, these tests are false positive. They do not confirm any diagnosis and tells us about only possibilities of having any defects. For confirming the diagnosis, the doctor might require additional tests. Also, if the result is positive, it may not necessarily mean that there is any defect. A lot of other factors are required to confirm any diagnosis. Also, it is very important for you to get tested from a reputed and reliable lab. A link to a reputed and reliable lab will be provided to you in the description below. If you have any questions or any suggestions, please feel free to comment down below.